Welcome and thank you for joining us. My guest is David Yoder, Senior Vice President of the Federal Employee Program at Blue Cross Blue Shield. David, thank you so much for being here today.
Oh, thanks. I appreciate you having me.
So we know that during open season, federal employees and federal annuitants who are in this healthcare program are, of course, figuring out what's going to be best for them. And through all of that, cost is usually a top consideration for a lot of people. So can you walk us through how Blue Cross Blue Shield determines its premium rates each year and how people can keep track of or better understand how healthcare costs are put together?
Yep, absolutely. I'm happy to walk you through that. So it's actually fairly simple. So because we're a nonprofit company, we don't have to worry about building in profit and when we set rates, unlike other companies. We essentially just take what we anticipate the medical benefit costs for both medical benefit as well as pharmacy benefit would be for our members over the ensuing year, and then we look at where our experience has been over the last couple of years, and then just make those extrapolations into the future and set rates that way. I would say our rates, because we don't have a profit margin built in, about 95 cents of every dollar actually goes back to pay for medical costs for our members. So we try to be very judicious about how we set those rates because we want to make sure we have affordable products. We want to make sure that our members are able to access the products we have. The other thing I would say is, as members think about how when they shop, is it's true that they're looking at dollars, but sometimes what gets lost is people just look at what the premium is. What we want members to be able to do is say, let's compare premium, but then let's also compare what your out-of-pocket costs are going to be. Because a low premium may look good on paper, but then you may have much higher out-of-pocket costs that you have to incur. And by the time you incur all those costs plus the premium, you may have been able to go into a different product that may have had a slightly higher premium, but a little bit lower out-of-pocket costs for things like office visits or copays for your drugs or even ER visits or telemedicine, things that people are going to utilize on a very frequent basis. You need to make that cost estimation. And we've got some fantastic tools that we give to our members and as well as prospective members so that they can try to figure out what their ultimate cost is going to be based on their utilization, based on their drug histories, so that when they make these choices, they're making choices based on as much information as they possibly can. So we try to make those tools available. They don't sit behind our firewalls. We have them available to anybody from the public that would like to take a look at it if they're shopping. Obviously, we focus on federal employees and retirees, but we want to make sure that they're making the best choices possible because if they make a really good choice in their products, then they're going to be satisfied with the products they have. The last thing anybody wants and the last thing we want for our members is to have someone choose a product who they thought it was a good product for them, and then once they get into the year, find that it really doesn't meet their circumstances. And we want them to be a really good informed consumer.
And let's dig into that point a little bit more too, because cost is, of course, a really big part of the consideration during open season, but there's a lot of other things that go into what makes a federal employee or an annuitant choose this final option for them. So what are some other factors that should be considered when they're deciding on their health plans?
Yeah, absolutely. It's not just about the cost. So, some of the things that we would encourage members to take a look at would be network size. So, not every hospital, not every provider is in a network contracted provider for a health plan. And that even varies amongst the different products that you may have in the marketplace. So we have a couple products. We have 3 products in the marketplace. One of them has the ability for you to go out of network. So if you have a provider that you really want to see, we have benefits that'll cover that. Our other products don't have those benefits in place. So if you have to stay within the network, but then it's not just a network, it's how broad your network is. So some plans and efforts to keep costs down have a much more narrow network. So not every hospital will be in network, not every provider will be in network. So you look at that. The other thing that really people utilize the most of anything is their drug benefits. So you you want to take a really close look at what the formularies are when it comes to drug benefits. So look very closely at whether the medications you're taking are actually covered on the formulary. But even within that formulary, there are different tiers that have different levels of cost sharing. So you want to make sure that you understand if you're taking a product, especially brand name products, that is your product covered, or there are alternatives that are covered that may be just as efficacious for you, but they're covered, or they may be covered at a lower cost share overall. So those are two of the bigger areas. I think the other thing, and it's more cost, but it's really looking at what, say, deductibles maybe. Does your plan have a deductible? Does your plan have an out-of-pocket maximum? What do those numbers look like? Because it's easy to see what a PCP copay is, what your premium is, but and we hope that members never are so sick that they have to go and access, where's my deductible, or where's my out-of-pocket maximum, to where they have a catastrophic issue. But those are some of the things you really need to take a close look at. And then the third thing I would say would really be around what's called utilization management. So, do you have prior approval? Do you have a lot of prior approval? What the medical policies are around that. So things that people don't really think about when they're buying health insurance, but they can really be a big game changer when they actually start to access the benefits that they have.
And are there any significant changes to the actual benefits this year going into plan year 2026 that employees should be aware of too?
The Office of Personnel Management did not make a lot of changes this past year, or for, I guess, the ensuing year that we have coming up. But for the past couple of years, they have made some fairly large changes. So OPM had encouraged carriers starting a couple of years ago to offer IVF benefits. As new federal employees come in, especially in the younger side of the workforce, that has become a very attractive benefit offering for those employees. And we've heard the administration talk about this as well, is that, it's almost an essential health benefit, the way they look at it. So we actually led the marketplace starting a couple of years ago, to where we offered a full IVF benefit to our members with fairly minimal restrictions moving forward. We were one of only two carriers to actually do that when we first started. Some of the other carriers have started to catch up to that. So we're already there. We already have those benefits available. Didn't have to make those changes for next year. There have been some changes in some of the weight loss products that are out there. So, the GLP-1 products are the rage these days. And we did make a few changes to have some preferred products in that marketplace, as opposed to just having open access. But generally, we have not made a lot of changes this year. A few tweaks and copays, things like that, but no major benefit changes going into 2026.
Looking more big picture too, one other big change that has happened this year was, of course, the presence of a government shutdown. That can cause a lot of uncertainty for employees, whether that's in their financial life, personal life, their careers. So generally speaking, if we're looking at this from a benefits or open season perspective, can you walk us through what happens with Blue Cross Blue Shield and those benefits during a shutdown?
Yep, definitely. And I would even back it up further than that, because, if you look at when the administration first came in, and there were a lot of RIFs, the deferred resignation program, things like that, there was a lot of challenges to federal employees and what they had. And as I told my staff many times, in the midst of all these changes, the one thing that they really need and depend on is their health care. That's the one constant they may have. Now, of course, as we fast forwarded into, potential government shutdowns, things like that, the one thing, again, that, members, we reassure our members that, we're here for them. We continue to process claims. They still have their benefits. So even though they may not get a paycheck, we still are able to provide coverage for them through this process. No changes in the benefits. We're still answering the phones. We're still paying claims. We're still helping members when it comes to care management, when it comes to, hospitalizations, any of those types of things. We continue to provide those services no matter what happens moving forward. So it's, we try to make sure members are reassured that we're going to be here for them. There's no changes overall. And it can be challenging because, they face a lot of challenges. I happen to live in the Maryland, Virginia area, and I've got neighbors that have our insurance, and, they ask the same questions like, what's going to happen? And the easy answer is nothing's going to happen. Nothing's going to change. Things are just going to keep on rolling, and you still have your healthcare coverage. So people certainly when they hear that, that it puts their minds at ease a little bit more. They still have other challenges they got to deal with, but that's one less thing they do have to deal with in the midst of a lot of changes.
I'm sure that would be very nice for a lot of people to hear. And just wrapping up here, David, we're almost out of time, but can you tell me just to finish up here, what sets Blue Cross Blue Shield apart in the larger federal health insurance landscape, and why should federal employees consider it?
Well, a couple things. One, this is our 65th year of offering benefits. So we've been in the FEHBP since the inception of the program back in the 60s when it was first brought to federal employees. So, this is all we do. We don't have any other commercial insurance from the Blue Cross Blue Shield Association. Federal employees are the only constituents that we serve overall. I mentioned, I happen to be in the Maryland, DC area. We're based here. So, while I have neighbors and friends that are our members, it makes it a very personal conversation for us because we understand exactly, what the changes we may have to make and what some of the challenges are because we talk to these people. I've got people on my staff that have our insurance because they may have a spouse that's a federal employee as well. So it's a very personal thing for us. It's not people just aren't numbers. They're people. We try to go out during open season. I'll be at the post office headquarters during some open season events because I love to be able to talk to our members and find out what's on their mind, what do they need, how are their benefits working for them. All our staff does go out and do the same thing to where they get direct contact with members so they understand what their needs are. I think that sets us apart because we are the largest carrier in the FEHBP, and we are dedicated 100% to what we do. And it is our mission to be able to bring the best benefits we possibly can to federal employees and to make sure that they can get the coverage they need at an affordable price point. So we offer multiple benefits, price point benefits for them. So we've really got something for everybody. And then, of course, we've got dental and vision products that we sell to the members as well. And that's super important. And I know this is not part of that, the work that you do, but we also sell our dental and vision products into the active duty and the TRICARE retirees as well. So we have a very extensive outreach when it comes to the military population. I served for about 6 years, and again, that's a very very specific thing that I like to pay attention to because we look at federal employees who may not be active duty as they're serving as well, just like the folks in the military serve their country too. So we look at it as our mission to be able to bring the best possible health care to those folks who have made the choice to come serve their federal government and the nation overall versus going into the commercial world. So it really is a mission for us.
Great. Well, I think that is a wonderful note to end on. David, thank you so much for joining me today.
Absolutely. I appreciate you having me and looking forward to open season. So thank you.
David Yoder is Senior Vice President of the Federal Employee Program at Blue Cross Blue Shield. And I'm Drew Friedman. You're watching Federal News Network. Now we're going to go back to the studio for more on our open season exchange.